Obviously, you know, here it's saying tobacco, alcohol, drugs, infection, radiation can harm a developing fetus. There are many more things, viruses, medication, bacteria, you know, lots of different things here that can get in and harm the baby. Here's some list of things. I don't like that they list here Tylenol because it's talking about a likelihood of ADD. Tylenol's like the only thing that a pregnant mom can take. She cannot take ibuprofen. She can't take aspirin. So Tylenol's her only thing. And then to say that it possibly can increase a risk of ADHD, I would be really careful with that, you know, in making that connection. But anyways, it's there. You know, certainly when you're pregnant, you probably just want to ask yourself every single time, is it worth it? You know, if you have to take something, you know, is it worth it? Is your pain that bad that you have to take pain medication for it? You know, obviously this is why you want women to be careful when they're pregnant. You don't want them climbing things or doing crazy things, because if they happen to get hurt, we know accidents happen. If they happen to get hurt, they're going to do things that are going to cause possible risk to the baby. So say she's climbing something, she's climbing a ladder because she's like, I can do this, I can, you know, hang this or whatever. If she happens to just say step off wrong and she twists her ankle, they can't do radiation, they can't do an x-ray. If they have to, if you think it's broken and they have to do an x-ray, then you're potentially causing significant harm to the baby. Can you handle Tylenol for a broken bone? You know, would that be good enough for you? If it's not good enough for you, then you're going to have to look at other pain medication, which could cause harm to the baby. So when they tell you to be careful and not to do things, it's not because they think you're weak or less than. It's serious problems could happen. And if you had to go into surgery or all of those crazy things that could go down, you're possibly causing risk to the child. Here's some of those infections, right? Rubella, herpes, HIV, chlamydia, and the list goes on. You know, we now know that Zika, right? The virus Zika causes harm to the babies. And I'm sure there's a lot more than that. Okay. Let's see. So now we're getting to the second trimester. This is usually a much better trimester for moms. They aren't so tired anymore. Usually morning sickness goes away at this point. She starts looking more pregnant, so she needs maternity clothes, and you know, people start to notice that she's pregnant. It's just kind of a happier time for moms. She also will start to begin to feel the baby move. The first time we call it quickening, and it's just like this weird little flutter that you feel inside. A new mom may not be able to quite figure out what that is. It might take her some time. It may not be till about 5 months. An experienced mom, or you know, possibly sooner, about 4 months, you could start to feel that movement. So these are just some different tests that may or may not be done during your pregnancy. Ultrasounds will be done. Those are good. Those are nice. You can do ultrasounds. Depends on your insurance, and it depends on the risk of different, either the baby or you. You may or may not get more ultrasounds. 2 is pretty common here in El Paso and in Texas. Amniocentesis, chorionic villus sampling, these are not tests that you have to do. If your doctor wants to do them, you do not have to, okay? Sometimes I have people say, no, they told my mom she had to. You do not. okay? But they can be done in order to detect chromosomal malformations or problems with the baby. You know, Down syndrome or cystic fibrosis, different things like that would only be able to, you would only know if you did one of these tests. I want to see if it shows a picture. Yeah. So amniocentesis is a needle that goes through the mom's abdomen, all those muscles, through the uterus, punctures the amniotic sac, and takes out some of the amniotic fluid. Okay, one of the major risks with this test is, since you're bringing something from the outside into a very protected inside, you can introduce infection. You can also, because you're puncturing the uterus, you could trigger a miscarriage. Chorionic villus sampling is intravaginal, okay? And then they go in and they biopsy a piece of the placenta, okay? This one has a particularly extra risk to it. You can, of course, introduce infection. You can, of course, trigger a miscarriage, but you can also cause limb damage to the baby, okay? A biopsy is kind of a, it's an interesting process. It's, they have to like kind of pull on this syringe and almost like suction or vacuum pieces. And so it's not super controlled. It's not like a little robotic arm going in there and taking off a piece. So they can cause damage to the baby. You know, sex during pregnancy is fine unless your doctor tells you cannot, okay? Reason you could not is if you have, you know, certain conditions. If you have a low-lying placenta, if your placenta is starting to kind of like, you know, have problems with the uterus or something like that. So there's several different problems, and obviously only your doctor would be able to tell you that. Moderate exercise, obviously walking, is beneficial. Let's see. So the third trimester, you know, the baby has a really good chance of survival at this point. They call it the age of viability is 25 weeks, that a baby has at least a chance of survival outside of the womb. It's going to be risky, right? It's going to be risky. It's going to need a lot of medical intervention. It's going to be in the NICU, but at least it has a shot of survival. So the further you go along, then the better chances of that baby making it and surviving. You know, premature births are risky, and so are delayed births, right? If the doctor lets the mom go too long, then that baby runs a risk of starvation, actually. So, you know, some women might deliver at home. There's birthing centers, there's hospitals, obviously, but honestly, you know, you do you, and I hope you do your due diligence and you really educate yourself. But there's always something that could go wrong. And if something goes wrong with you, in your uterus, if it ruptures or if it starts bleeding, the hemorrhaging can happen so fast. How quickly can you get to a hospital? How quickly can you get to medical intervention? If there's something wrong with the baby, how quickly can it get medical intervention? And I think those things are very important and very necessary to consider. So these are just different things that, you know, you can do to prepare for birth. Lamaze is a breathing method. Okay, it's a breathing technique to help you breathe through pain, to breathe through the contractions. Okay, the Bradley method is no medication, nothing. Okay, obviously some moms are having birth in water, and a perineal massage. This is in between, the perineum is in between the vaginal opening and the anus, that layer of muscle that's all through there, you know, kind of massaging it to try and open it up so that it doesn't tear. Okay. So here the baby is getting ready to be born, right? We call this engagement, when it is kind of dropped down closer into the birthing canal and is ready to be born. As you can see, you know, sometimes people talk about they're scared to give birth because they think that the baby's shoulders, that's a very you know, you think of like an adult, our shoulders. Babies are not like that. Their heads are huge. A newborn's head is a third the size of its body. And its little arms and shoulders, you know, those muscles or bones are still so flexible, and so the shoulders are actually smaller, you know, so it's not like that. They wrap up really well. It's really the head that we have a hard time passing through the birth canal. You know, our women's hips, while they are wider than men's, they're not that wide, you know. We're not like a cow, we're not like a dog or an animal out in the wild. Those animals walk on all four legs. Since we stand upright, our hips are much narrower, and our hip to head ratio is much tighter than any other animal out there, and that's why it's so dangerous for women to deliver. Effacement is just this thinning out of the cervix, okay? Dilation is the opening of the cervix, right? So we go from a very closed to about 10 centimeters, which is like that, okay? So dilation is opening up and of that cervix, the space in there. That dilation process can take some time. You know, they say here about 24 hours. Obviously, doctors can give they can give oxytocin, they can give Pitocin that can further along the labor process. They can go in and break the water if the amniotic sac hasn't broken yet. So those are a couple things that could trigger and help labor along a little bit. No matter what, they're always monitoring the baby to make sure that the baby's not going into distress, and they're always monitoring the mom to make sure she's not going into distress. So anesthesia, you know, an epidural is where, you know, the mom kind of from the waist down can't feel anything. So just to reduce pain there. Closed cervix, baby starting to, you know, the cervix is starting to open, opening wider and wider and wider and wider. This is kind of like what right here and right here and right here is kind of what we call effacement. So you can imagine if you have that closed cervix and it's starting to open, but you have this big head that's starting to push through here. Obviously, this skin around the opening of the cervix is going to get stretched and pulled and really thin out. That's what effacement is. Here's a picture of an epidural. It's not just a shot, it's actually an IV that's threaded into your spinal column and then taped, and then it's on a continuous drip. Okay, your moms and your grandmas might scare you about an epidural, that you're going to have problems and so on. You know, they've really gotten a lot better over the years with epidurals and administering epidurals, that those side effects are very, very small now. They don't have the same issues that they did along, you know, 20, 30 years ago, right? I had one epidural and it was fine. And then my other two kids were C-sections. So that's a spinal block, but that's a little bit different. But, you know, I highly recommend the epidural. It's nothing to be afraid of. It doesn't hurt, I promise. All right, let's see. Second stage of labor. So the first stage is just that dilation and effacement. The second stage is actually the birth. And so this is when the baby, you know, obviously passes through the birth canal or is taken out from the abdomen through a C-section. The third stage of delivery is something that you never see in movies. They don't talk about, but this is where what they have to get out the afterbirth, or they have to get out the placenta. Okay, and they need to get all the pieces, everything out of the uterus and make sure it's good. Obviously, during this point, if she gave a vaginal birth, if she tore, or if he did like an episiotomy, they're going to have to stitch that up. If you had a C-section, they're going to have to stitch together the uterus, the muscles, and then your skin. Okay. This is showing, you know, the baby passing through the birth canal. And again, just how big that baby's head is, like its little eyeball right here, like what in the world is happening? So it's really the head, guys, that you have to worry about passing. Okay. And yay, he's like, I made it, he's here. So baby is born. And let's see, what is this percent of all births? Oh, I have no, oh, C-section. I was like, I have no idea what that's talking about. That is one thing I always forget about this class, human sexuality. And maybe it's just this author. They are so bad about labeling their graphs. If you've ever taken statistics with me, I am a big stickler on, you know, when you look at a graph, you should just automatically be able to read all the information there. You shouldn't have to go searching for what is this graph about. And so I'm always amazed that they do that. But anyways, I'm assuming it's up here, and I'm assuming it's talking about the number of C-sections that we now have in the United States. So you can see here, this baby, this was a C-section. Right, you can see how wide and how open this mom's abdomen is, and they take that baby out. C-sections are performed at a higher rate these days than in the past, and some people say that that's a bad thing, and some people say that it's a good thing. So let's see, I'll go the bad route first. They say it's a bad thing because babies should pass through the canal on their own. There's a lot of benefit through a vaginal birth. You squeeze the fluids out of the baby's ears and chest, you know, so they're less likely to have hearing problems. They're less likely to have lung problems right after birth. Some people say that there's a passage of like bacteria and stuff like that, and that's beneficial to the baby. You know, and it's less expensive, and it's an easier recovery for the mom. So those are kind of the reasons, you know, that vaginal births are why it's bad that they're having C-sections. The benefit, or the reason why we have so many C-sections now, is numerous. If the mom has herpes or other infections, she cannot give a vaginal birth. If she is HIV positive, she cannot give a vaginal birth. Sometimes the baby's head is so big and the mom is so small that the baby is not progressing. It's not passing. The baby is showing distress. The mom is showing distress. That will end up in a C-section. If the baby is breech, but first, if the baby has the umbilical cord wrapped somewhere, those are all C-sections. You know, and the doctors prefer C-sections. One, you could go the cynical route, they're going to get paid more. Or if you think about it this way, OB-GYNs are the #1 sued doctor in the United States. And a vaginal birth is a very risky and uncontrolled situation. When a doctor has a mom and is doing a C-section, the doctor is in control of that situation. So it's a very controlled environment, and doctors like control, right? So those are a lot of the reasons for why you know, C-sections are performed. Another reason why C-sections are performed is once you have one C-section, you're going to have a really hard time finding a doctor that will do a vaginal birth after C-section. They call that a VBAC. Many doctors will not do that. They will do another C-section, and that was my case. Ava was a C-section because I had high blood pressure, and I was swelling everywhere, and she didn't have, she was measuring to be very big, and she didn't have any more amniotic fluid. So it just ended up like in we just did a C-section. And so after that, then Matthew, even though it would have been fine, it was just an automatic C-section because they get worried that, you know, that uterus has already been cut and stitched up. So there's scar tissue, and scar tissue is not as strong as regular tissue. So they worry that as the uterus grows, will that scar tissue tear apart, or the stress of birth, will it cause it to rupture? So many doctors will just perform another C-section. I liked the C-sections. Those were my favorite. And yeah, so I don't know. You know, postpartum depression is obviously something to consider. It is real. It's not fake. No matter what Tom Cruise says, postpartum depression is attributed to several things: a dramatic decrease in hormones and a change in hormones, but then also socially, mom has new responsibility, relationships change, you know, kind of the realization that you have to take care of this creature now. So there's a lot of different things that could lead to postpartum depression. Now, obviously, postpartum depression that's accompanied by psychoses, if she's starting to have delusions, or you know, thinking of killing herself, or thinking of killing her children or child, this is a very serious postpartum. So if you know a mom that's suffering from postpartum depression, you know, try and encourage her to talk to her doctor. She might need medicine just for a few months right after birth, right? An antidepressant, really low dose, she would be fine. Doesn't mean she has to be on it forever once she gets through those hormonal changes. You know, parenthood, it's, you know, it's demanding, right? It's hard. There's a lot of changes that happen, you know, but I think if couples go into it knowing that it's going to be a big change then in their partners, then it can be done really well, and it can be a happy time. You know, sexual activities decline, you know, obviously marital conflicts increase. They say 9 times. So if you're fighting with a boyfriend or a girlfriend, you know, thinking that having a baby is going to make that better is absolutely the worst thing you can do. Your fights are going to increase 9 times. You know, perceived quality of marriage begins to drop. We tend to see partners go into the very stereotypical, you know, roles. Dad is like, I've got to go work, I got to bring home, you know, money, and moms are like, I'm cleaning, I'm taking care of children, and doing all that stuff. But I think if there's communication, and there's equality, and there's trust and openness with that couple, then they can get through that process. New moms, pretty much on a day-to-day basis, report being very unhappy. Our moms of young children kind of historically are least happy walking around this planet, and they're the most stressed out. So be kind to new moms. If you are a new mom, or remember this when you are a new mom, it doesn't last forever. Okay, you're not going to be like that forever. It gets better, I promise you. So There's that. My doorbell just rang and my dogs are going to go crazy. Hold on. Oh, sorry, guys. Okay. So let's see. I don't know what I was talking about. I apologize. I was probably just rambling about something. So let's see. Oh, lactation. I just want to see how much more we have because we're almost getting there. Oh, not too much. This is just about breastfeeding. Oxytocin and prolactin are two hormones that assist with breastfeeding, you know, and it really is, it's so important to at least attempt to breastfeed. There's a lot of benefits to breast milk, you know, all those good antibodies, giving the baby really good nourishment, and you know, they say, and that bonding and all the good stuff that you can do. It helps you lose weight. You know, it's a great calorie burner. But on the flip side, there's a lot of moms who can't breastfeed. You know, if you have HIV, if there's certain medications that you take, sometimes breast implants impede the process of breastfeeding. So I don't want moms to feel like they're less than or they're inadequate if they can't breastfeed. You know, taking care of your baby and feeding your baby is number one, and how that happens is your choice. So here's the contents of breast milk. Formula, you know, has a lot of those same, you know, ingredients and good vitamins and nutrients and things like that. The bad thing is it's expensive. You know, breast milk is free and it's everywhere you go. And that's why I think those are really the best pluses or pros to breast milk. Infant formula is expensive. And I really get concerned when you hear things that moms are trying to save on the formula. So they start reducing the amount of formula that they put in water. They really start watering it down just to try and save money. And that is not good. That baby needs all of that fat. That fat is so important for the baby's brain development. So do not skimp on infant formula, please. So there's some of the breastfeeding. Oh yeah, it shrinks your uterus. That's another thing they don't tell you. It hurts at first when you start breastfeeding. And it causes cramps because it's shrinking your uterus. So that's just really cruel and unusual punishment. It also can help reduce the risk of ovarian and breast cancer. Yes, right. Okay, right down here, contraceptive effect. Yes and no. Okay, so we want to be really careful with that. Moms always think, oh, I'm breastfeeding, I won't get pregnant. And then sure enough, you know, now you have 9 months later a baby. It only breastfeeding for contraception only works if you are breastfeeding on demand all the time. No substitution with formula, no skipping, no nothing. You are always, it's on demand. 2, within 6 months. 3, what's the third one? Oh, obviously you haven't started menstruating. Okay, so the minute you substitute and you give that baby a bottle, even if it's because you pumped or something like that, they say you've messed it up. If if you've started your period, you're going to get pregnant. And if it's over 6 months. Okay, so yes, right. Breastfeeding does have painful disadvantages. Painful, inflamed nipples. They can become cracked. They can bleed. No one tells you this stuff. It can be very painful. You can also get an infection in the breast. One of those milk ducts can become clogged, and it can cause a lump and swelling and pain. You know, infections, like I said, HIV, hepatitis, you're not allowed to breastfeed. Okay. And yeah, if you have to go back to work, right? When do you get to stop and just pump? And then can you store it? Do you have some place for you to be able to store that milk? It needs to be refrigerated. It needs to be frozen. And that becomes very inconvenient for moms that are working. So, yay, look at that, 12:01. I made it within about the hour. I apologize for having to get up. Somebody rang the doorbell. So are there any questions? No, I know it's pretty straightforward. So let's see, I'll start closing all of this stuff out. Let's see, I know what I did now. I messed up here. All right, so I'll see you guys later. Tomorrow is the exam, and it'll be open through Sunday. And then you have spring break next week. So I will see you on the week of March 22nd. Thanks, bye.